Today we're going to talk about the modern healthcare system in the United States and get a history and timeline of how we got to where we are today. In 1901, the American Medical Association becomes a national organization. Membership goes from about 8,000 physicians in 1900 to 70,000 in 1910. This is the beginning of organized medicine. Doctors are no longer expected to provide free services to all hospital patients. The Depression in the 1930s changes the country's priorities to a greater emphasis on unemployment insurance and old age benefits. The Social Security Act is passed, but doesn't even mention health insurance. In the 1940s, penicillin becomes widely used and has a dramatic effect on the leading cause of death at the time, infection. During the Second World War, wage and price controls are placed on American employers. To compete for workers, companies begin to offer health benefits, giving rise to the employer-based system we have in place today. President Roosevelt asked Congress for an economic bill of rights, including the right to adequate medical care. By the 1950s, more medications are available to treat a range of diseases, including infections, glaucoma, and arthritis. New vaccines become available that prevent dreaded childhood diseases like polio. The first successful organ transplant is performed, and the price of hospital care doubles because of all of the new services. In the early 1960s, those outside the workplace, especially the elderly, have difficulty affording insurance. President Lyndon Johnson signs Medicare and Medicaid into law. The number of doctors calling themselves specialists grows from 55% in 1960 to 69% by the end of the decade. By the 1970s, healthcare costs are escalating rapidly, partially due to higher than predicted Medicare costs, along with rapidly rising inflation. People are living longer with the greater use of technology, more medication, and a growing list of expensive, cutting-edge treatments. People start to question if the American medical system can sustain itself with the rising costs. In the 80s, corporations began to integrate the hospital system, previously a decentralized structure. Overall, there's a shift towards privatization and corporatization of healthcare. By the 1990s, healthcare costs rise at double the rate of inflation. In the 2000s, healthcare costs continue to rise, and Medicare is viewed by most experts as unsustainable for the coming baby boomer population. Premiums going up by double digits each year, along with the aging of the workforce, lead many to believe that health insurance through your employer can't last. Direct-to-consumer advertising for pharmaceuticals and medical devices begin to engage the consumer in the process. The internet begins to put quality medical information in front of consumers, both from news sources like WebMD and trusted centers of excellence like the Mayo Clinic and others. By 2010, Facebook, Twitter, YouTube, and other social networking sites continue to revolutionize communication. Consumers go online to learn about everything, including their health. The passage of the Affordable Care Act makes major changes to the future of care, putting more emphasis on prevention and detection. In 2012, a Silicon Valley doctor launches StepOne Health, an easy connection to new healthcare. StepOne Health is a digital starting line that allows consumers to be proactive, informed, and in charge of their healthcare decisions. StepOne Health combines easy access to early detection and prevention with a community of connected people, changing the healthcare experience. The StepOne Health consumer experience starts with a free private health record, or PHR, where detailed lab results answer the question, what is my health like today? The private record then connects to the tools and people who are waiting to help. Working together in a community, everyone can make informed decisions and track changes in his or her health over a lifetime. Because knowing your numbers is where you start, the first StepOne Health partner is MyMedLab. MyMedLab is a leading provider of direct-to-consumer laboratory testing services. MyMedLab will provide all eligible StepOne Health members with a baseline panel of 65 different tests with no out-of-pocket expense. Members can determine if their health plan qualifies for the free benefit by going to StepOneHealth.com. Those whose health plans do not cover the cost can purchase the same benefit for a discounted price. Understanding your health improves the quality of life for you and your entire family. Joining StepOne Health as a family and creating a private health record for each member of your family encourages healthy habits that last a lifetime. StepOne Health membership is free for everyone. To get started, visit StepOneHealth.com.